Where are you at?
Yep.
Where are you at?
Hi, Sonia. My name's Ryan. Can you give me your name and date of birth?
Sonia Gillespie, 8/28/72.
Okay, and we're going to be doing a neurological assessment on you today. Do you know where you are at?
I am in the doctor's office.
Okay, and what time did you arrive?
9 o'clock.
And when was your last clinical?
Last month.
Okay, I was just assessing her recent and remote memory and her verbal responses. As she walked in, I was observing her gait, which was even, steady, straight. There were no tics or odd movements. Her general appearance seems clean, good hygiene, no facial drooping. Her posture, she's sitting upright. And, we would take her vital signs, so we'd take her blood pressure, her heart rate, her respiration, her O2, and her temperature. And as she was answering those questions, I was observing her speech pattern, which was clear and comprehensive. Okay, Sonia, we're going to go ahead and start with your motor function. So we're going to do the Romberg test. So if you could stand up for me. With your arms out, your palms up, and your eyes closed. Okay, I'm just observing for like steadiness. She's not wobbling or anything, so that's assessing her balance. And okay, we're good on that. For her muscle tone, we're going to be observing for atrophy, coordination, and strength. So, can you press your fist up for me against mine? All right. Down. All right. Okay. Lower left hand. That works. Okay. So we're gonna do that on those extremities and her lower extremities too. So her knees. So press your knees outward. Okay. She's giving me resistance. That's good. Okay. Now inward. Okay. And while I'm down here, I'm going to go ahead and do her pedal. We're going to do your pedal presses. So let's go ahead and just put both your feet on the ground.
Okay.
Now can you pull your toes to your nose?
Yep.
Okay, good. Now go ahead and put your, all right, now press down. All right, good. All right, and while I'm down here, I'm going to go ahead and do the Babinski's test also, which I'm going to take the bottom of her heel and just stimulate that, and it shouldn't do anything. If it flares out, that is a bad sign. That should not be present in adults. Same for this foot. Just going to run my pen up her foot. Okay, good. Okay, I'm going to test her sensation on all four of her extremities. Okay, so Sonia, I'm going to have you close your eyes, and I'm going to touch both of your arms and then your shin area, and you're going to tell me if you feel a sharp or a soft feeling. Okay. All right.
Soft. Sharp.
Down to your lower extremities.
Soft. Soft.
Okay. Which she was good on all those. All right, now we're going to go to your cranial nerve assessment. Oh, I forgot to do your grips. So can you just squeeze my...
Yes.
Okay, good. Good on the grips. All right, cranial nerve assessment. I'm going to start with cranial nerve number 1, which is the olfactory. Sonia, can I have you close your eyes and close one of your nostrils? And I'm going to have you smell something, and you tell me what that is.
Okay.
All right, go ahead and smell.
Cinnamon.
Good. Now can you close the other nostril? Let's test that one out.
Coffee.
Okay. Good on that cranial nerve. Okay. Now I'm going to go to your optic. Cranial nerve 2, which I would look at her optic nerve with an ophthalmoscope. We don't have one of those, but we would do that. Cranial nerve 3, I'm going to go ahead and just cuff your eye, and I'm going to check the constriction of your pupil here. Okay, on your other eye. Good. All right, cranial nerves 4 and 6. These are going to test the movement of your eyes. So I just want you to follow my pen light right here. Just following it with her eyes. No head movement. Okay, good there. Cranial nerve 5. We'll test for that and see how it's doing. Sonia, can you clench your jaw for me? And then I'm going to try and move your jaw left or right. Okay, no movement. All right. That tests the motor function of the jaw. And now we're going to test the sensory. Okay, can you close your eyes for me? And you tell me if this is soft or sharp.
Soft.
Same for this side.
Soft.
Okay. Now we're going to go jump to cranial nerve 7 since we already did 6. And on this one, I'm just going to have Sonia smile for me. Okay, now puff your cheeks out. All right. Good job. Now we'll move on to cranial nerve number 8, which is the acoustic. And I'm going to have her cover one of your ears, and I'm going to whisper, do the whisper test.
Nursing school.
Okay, now I'm going to have her cover her other ear.
Red wine.
Okay. She passed that. Now we're going to go to cranial nerve 9 and 10. And I'm going to have her say ah, and I'm going to assess the movement of her palate. Okay. Good job. Now on to cranial nerve 11. And to assess that, I'm going to place my hands on her shoulder and have her shrug. Okay. All right, and now cranial nerve 12. I'm going to have her stick her tongue out. Okay, and when she does that, I'm just looking for any deviation of the tongue moving left or right could signify any damage done to that nerve. And back to the Glasgow Coma scale, her eye opening is spontaneous, so she gets a 4 for that. Verbal responses were oriented, so she gets a 5 for that, and she obeyed commands really well for her motor responses, so she gets a 6 for that, for a total score of 15. And that concludes our neurological assessment.